Hey everyone, Michael Giakoumis here, a sports physiotherapist in London based at Melbourne Health Group. What I'm going to be talking about today is persistent groin pain. Now, persistent groin pain, there's actually quite a complex area because there can be many symptoms or many differential diagnoses that can be given yours. Some common symptoms though can be ranging from an acute episode with some sharp pain, which can lead us down sometimes a muscle tendon problem, towards of an ache that warms up, but once you cool down, it can get sore and stiff, and it can get to a point where it starts to worsen, where it no longer warms up, and you're still sore during and after activity. And again, the reason for this complexity is that there's so many different structures that go around groin. The hip can be referring there, so we need to make sure that that's clear. But also, there's your abdominals, the inguinal area, which often you might hear is hernias, and we need to differentiate those. But also the bone and the joint, as well as the muscles around your adductors as well, or your groin muscles. And so coming to see me, who specializes in this area, what we end up doing is providing and going through a thorough, individualized and systematic approach to try and find out what is the diagnosis, which certainly influences your management. And so that's really important because sometimes I need to work with a sports medicine doctor or a surgeon to help this, and having us and connecting us with in Melbourne Health Group, we're able to have a really strong connection with many different leading specialists in the area that can help and support us as well as you in order to get on top of your problem. And if we were to take one particular example of an injury that can be around that area, is a specific diagnosis can be sometimes we can get some extra stress going through the bone of your pubic bone. So we call that a pubic bone stress injury. And these injuries typically present with sometimes either a loss of power, and that's one of the things that people often refer to first, which is an interesting thing, either in kicking or trying to sort of sprint or accelerate. And over that time, pain can start to get a little bit worse, or it can be vice versa, where they get a bit of pain, but then the power drops off a little bit later. And the diagnosis also can progress to where there's pain all the time. And we touched on that a little bit before, where some people can actually report some morning symptoms when they're trying to get out of bed. And with this particular problem, we do need to be really mindful that sometimes we need to calm things down. But we also know with these particular problems, there can be other things going on at the same point in time. When persistent groin pain occurs, usually there's not only one cause of your pain, but a number of factors. And that's why we need to take that individualized, thorough and systematic approach to identify this. Part of that process to be able to differentially diagnose and get the correct diagnosis might require some imaging, which helps to support our clinical assumption, because we know that imaging can show many different things that may or may not be relevant. So it starts off with a really clear clinical assessment supported by imaging, if that's the case, and an extra referral onwards if we need to. And usually treatment around this particular area does require a period of time of alterations to your training and your training load and the amount that you're doing till we get that bone to settle down. But during that period of time, we look to try to address the contributing factors and identify those during the process so we can work on those areas before we start to reload the area and get you back to what you want to get back to.